Alright, so Bobby is on his way to Athens.
I don't know if this is gonna go up. Oh, Jesus. I froze to it. Well, if it's anything like your back, it'll be crooked.
Lots of junk in there.
That's disgusting.
This is Nate. And this is Cindy. This is their shelter. We are a full circle of life horse shelter, and we never turn an animal in either way. Every one of them has a story and has paid a price. One thing we've learned in 11 years, you just never know what's going to come through the door. Welcome to the Horse Rescue Tales from the Tundra.
You guys ready? Alright, so Bobby is on his way to Athens to get that umbilical hernia redone. We are taking Envy with, hey baby, so he hopefully stays calm on the trailer. Whoop!
You just slipped, honey.
Careful, careful baby, you're okay. You're okay, honey. And then she'll come back. I'm stressing out. It's been a day. Come on, Bubby. You're all right. You got a little burr on your face. You'll be back. You'll be back. All right, buddy.
Oh, Bob.
You can do it. Just like Mom did. You gotta lift your foot.
Step up.
You can do it. There you go. Good boy. Good job.
Good stuff,
Careful,
Bobs.
careful. Okay. Oh, Envy, move your butt. All right.
Any instructions?
Drive careful. Take corners slow, so we're not.
Yep. Just don't turn the car off. Okay.
Do not turn it off. I don't
Okay.
care if you're sitting there for an hour. Leave it run.
Okay.
2 horses. That's gonna be a little tough to maneuver for one person.
Yeah. Bobby's gonna want to come out once we get there.
Yeah.
That's fine.
Just. Yeah.
Okay.
Okay. Off they go. So, Bobby is gone getting his surgery. So it is time to start the weaning process. We're gonna take Envy back out to her old crew of personal horses.
Done being a mama?
Cindy thinks they won't accept her. Let's all say they will.
I hope so.
Yeah, we think she's gonna get bouncy and excited. He's been in the stall for a while. We haven't been able to open the doors because it's been so icky out. She's gonna like this.
She's excited.
Yeah. Picking up the pace. What do you think?
Hold up, horses, Envy.
Whoop. Look, guys, it's Envy.
Oh, look at Mary coming in.
You got the gate, watch it. Even pose like a friend. Go ahead, girl. They're just like, yeah, cool, Envy's back. Yeah. Yep, that's Lopo. Oh, please, Mare. Us too, girl. Yeah. I expected it from you, plants. Right. Oh. Oh, have fun, kids.
Oh.
Oh, looking at the goats. Yeah, I don't know. There they go. What a cute little crew. Cammy and Panda are like running? Yeah, no. So we've got Star in the stock today for Dr. Kristin to take a look at her teeth. She's been losing some top line and such, so we're gonna see what's going on in there, if anything.
Did you have Val look at her? Do we think there's, as far as her top line, could it be like there's some nerve damage from that, or?
She did look, but she just kind of thought, because she's got a decently long back, that a small rider and just good saddle fitting, that she could do some light stuff.
But she didn't think that the top line could just be from the accident type of thing? Or?
Oh, she hasn't looked at her
she
since
hasn't.
that. No, she's actually out right now with
I heard
a
that.
shoulder injury, yeah, so.
Hopefully a horse didn't do it to her.
Yeah,
It did?
I'm not sure.
Oh, no.
I want to say it was, like,
I think Dave said something about it.
yeah, she was, I don't know.
When you're bracing and somebody moved
Yeah.
around. Yeah. Don't
So
need that.
We don't know when we'll see her again, but hopefully she heals up good.
No kidding. You're still holding your head up pretty good, and your paint. I can't trust paints. They're usually naughty. At least for this stuff. Oh, look at that. Has she been quitting?
I don't know myself.
Don't know too much. Okay. I hear everybody's been sick, and I have
Yeah.
total sympathy because that's been my family and life as well.
Yep, it's been going around like crazy, especially that neurovirus with the stomach and.
Yep. And then it's like you go back and forth between them too, because then my sister was so sick, she finally went in and they diagnosed her with the influenza A.
Oh, yep, I've heard that one going around.
Hey, this is warm water. You should like this. Is she the one that was making so much noise when she was eating?
Yeah.
Okay. Yeah, she was really going to town on that babe. Oh, it's cold. You're really clenching, baby girl. You need to calm down. Yeah, that jaw of yours is clenching. Yeah, I know. Oh, your tongue is hanging out. Oh my God. I don't know if this is gonna go up. Oh, Jesus. I'm froze to it. That feels nice. Let's see. Warm water. I didn't expect it to be quite as cold out this morning as it ended up being. I thought it was supposed to warm up after Tuesday. Oh, yeah, I ain't gonna go up.
Uh-oh.
It is what it is. That's all we get. Even though I'd like you up higher. What do you keep holding all the food on that side of your mouth for, huh? I know, pulling a big gob out, girl.
Ooh.
Well, she got it just really quite full up on that side. Okay. Kind of sharp. Okay, well, I'll start with the float, and I'll see if that tooth feels loose. She's moving. She's leaning pretty good. I don't know if I want to give her more drugs.
Excuse me. Holding her whole off right now.
Is she? Come on, give her a push on that front. She's gonna get her foot. Being silly, girl. Hey.
Hey, Ray. We'll help get her up.
Well, I'll put this in your mouth and we'll see what happens. Maybe that'll get your attention a little. God, I wish that I could put that up.
Oh. Nope.
No, it's froze. I was hoping I could get her up a little bit so I could see in there better, but... Alright, you're being silly. My hand is freezing to this. A loose tooth in the same exact spot as the other side. Let's see how it looks. Okay, good girl. Almost done, honey. Took off a lot of points in her mouth, but there's 1 or 10 on the lower right is a little bit wiggly. Trying to decide if we're going to want to tackle that today.
Okay. You're losing a tooth too, girl?
Maybe. And she doesn't seem overly happy about it, does she?
No.
I can only get a little bit of a wiggle about it, not much. Now I got it all cleaned out. I'm wondering if we just see how it does when it's cleaned out and the point is off of it, you know? Well, sometimes I've seen them firm up when they're only a little wiggly. Like if you can get the stuff that's out of it and line it up a little bit better where it doesn't have a big point on top that's poking it. So that's the type of tooth I'll check in 6 months. And I'll say, hey, you know, maybe we can keep that sucker. And that'd be okay. You know, it feels like it's wiggling less so than it was when I first got in there. So I'm more inclined to continue to monitor that tooth. I know, sweetie. Yes, you can give her tongue back. She didn't like it. She doesn't like it. But I took a lot of points off of this mare, so she should feel a lot better that way. Okay, I'm sorry. We'll give you your mouth back.
So, Mr. Buddy, they said that he needed his teeth done.
When
He
you
just hasn't-
surrendered him?
When they brought him.
And he's 20, I hear.
And just not putting on the greatest amount of weight.
Sure. Striker, too,
Oh,
so you know.
good to know.
Yeah, he struck through when I poked him with the needle the first time, and here he's like, he knows what I'm up to. And this is after having drugs on board. I was hoping it would slow him down enough, you know. And it slowed him down quite a bit. Hi, he doesn't care for this game. It's too bad. Well, your teeth suck. That's fun. He's worn them down to the gums in most places, so he's not going to be one that can handle a pure forage diet. He's going to need the grain. How are your ears that perky? Goodness. All right, I don't know how much you can see of that, but he's got nubs for teeth.
Oh yeah, I do see.
They're not doing him much good. Smooth, smooth. One sharp spot there, so I could float a little bit, but there's not much we're gonna do. 'Cause there's not much left.
Sounds good.
I feel tolerated. There's like maybe 2 sharp spots.
Okay.
Nothing major. I'm just gonna see if I can get that one sharp spot on this side, if he doesn't mind. Okay. There's literally nothing else I can do with that.
All right.
I'm gonna write down what all's missing and.
So this is Happy. He was a surrender. The lady suffered a back injury, so she wasn't really riding much anymore.
Sure.
Overall, from the sounds of it, he's a good horse. He's just got some arthritis.
Okay.
That's really kind of all the info we've got on him.
And he's fat.
Yeah, he's a big boy.
Yeah. Well, he's got swelling in the sheath, and I don't know if some of that's just because he's got so much fat deposit and stuff too. So we'll see. Yeah, big round butt. But you haven't had any other trouble with him. You said some arthritis though?
She mentioned some arthritis, yeah.
He walked a little bit stiff over here, but thought he was being careful about it being slippery. Hey, take it easy.
Says you take it easy.
Yeah, he's just kind of wagging his tail at me. Scratch him. 99.3. I'll just turn my light on so I can look at you a little bit. Hey. Are you happier now? Yeah, okay. Hey, you just stop. Yeah, 20. Sounds good. Hey, just see if I can see anything back there.
Easy. Okay.
Well, the front view don't look bad, so that's good. And obviously, he keeps weight on without much trouble.
Oh yeah, it is.
He has installed since Friday as well.
It's like hard. Yeah. Well, you can see if you could. I mean, you could give him a little bute and make him do a little bit of exercise, but I think that could probably use a cleaning too. Quite a bit of swelling in there. It's like hard. I can't even hardly squeeze it. I'm surprised he's not more tender. Since you just got him, why don't you exercise him, give him a little bit of bute or Banamine and see if that swelling goes down, and then we're gonna have to wash it on a nice warm day. I don't know if I want to put a bunch of water up there today.
Sure.
He'll just get frostbite or something.
Sure.
Yeah, it doesn't sound like a good place to put water even if it's warm. Oh, do you like that? Yeah? Do you like that spot? You were moving your lips for me. Okay, and then arthritis-wise, hi bud. Has Polly been working on his feet yet?
I don't know. He hasn't seen Polly yet.
Hi. Oh, you can be like that. Can I see this? I know I can't quite get in there with you. Come on, up, up, up. Oh, come on now. Be nice. He's like, I can't bend it. I have this thing in front of me. Come on. Come on, bud. Well, we'll see how he is for Polly. Maybe he's not excited about footwork. Square up for me. I'm going to pick up this leg. I'm curious what this arthritis is about because he doesn't look all knobby. I know. I can't get in there with you. Okay. Well, he flexed there okay. Maybe he's got some hock arthritis or something. Well, you just have to see how he moves and see how he does for Polly. He definitely needs a farrier work.
Okay.
But I'm more just want to kind of see how that sheath cleans up.
Okay.
That might have to be sedated on a warm day.
Sounds good. So this is Wednesday. She's a return from an adopter.
Okay.
They had her for probably about 2.5 months. Oh, girl.
Okay,
And
I'll get out of the way.
She said within the last couple weeks she's dropped a bunch of weight, which is obvious.
Yeah.
She saw the vet, did a dental. She has like a hole in her tooth and an abscess blew out.
from the tooth.
From my understanding, and you can see it.
Yep.
So we're not really sure what's going on. They didn't really dive into it. They just kind of
She
brought
didn't
her.
wanna deal with it. Okay. All right. You want to go around, be a good girl? Wednesday.
Did you touch on her age?
We hadn't done a dental on her here, had we?
No, we originally had her age 16 to 18.
Oh, yes.
And she was saying her vet's putting her closer to 24, 25.
Whatever.
Yeah. So whether she's 16 or 24, we're not sure, but
You gonna be a good girl? You kind of nervous?
good girl. Yeah, we got something behind you now. There we go.
Okay. But she has been. Was she on antibiotics or anything?
Not that I could see they had talked about starting antibiotics, but I think that was more so if they were going to follow through with the vet's recommendations, and they ultimately just brought her back.
So they were recommending taking the tooth out?
I believe so. We have the vet notes. I was going to have you look at them.
Sure.
So it does look like here, if I'm understanding, that she was on bute or sulfa, but that's kind of the whole whole workup that the vet wrote down.
Draining tract through mandible to 409, lucency over 409 roots. Okay, so they could kind of tell she was more like 20 because they could see how deep the teeth were on x-rays, so.
Okay. And the x-rays we haven't gotten yet. They did take some, but
Painful to touch, open and bleeding on the inside. Well, I would think they could just take that tooth out, but the owner didn't want to do it. Well, I mean, at that point, then they're down one tooth, and yeah, they need a little bit more food, but okay. Well, do you guys want me to get in there again, or do we want to do the round of antibiotics to get it kind of cleaned up a little better first? What were you?
maybe.
Did you take a peek at her teeth at all?
I haven't been in there yet.
I was just
but
gonna say, maybe to see what you thought for age.
Are you just thinking to clear up the infection before we dig in there?
Pretty
Yeah.
much.
Because if it was
I
really
think is what
if
we
it was
should
really
do.
sensitive and she hasn't been on antibiotics, it's like, well, she's not gonna be any better.
Right.
Right.
Off the wound here, girl.
My good. Just wanted to take a little tiny
My
peek.
mouth hurts.
I know.
Not a good girl for mouth stuff.
Just
There
a
you
little
go.
bit. Just a little bit. Oh, take it easy. Take it easy. Just a little tiny peek. We're not gonna dig in your mouth.
Yeah, I would agree. She's one of them that's kind of, these teeth disagree with these teeth as far as age, so 20s would make more sense, I suppose. Okay. Hi, sweetheart. Hi. Can I feel you? Are you gonna need to be sedated for everything?
She was not so cranky before, so I'm guessing it's causing her.
Yeah,
to
something
pain.
happened and, oh, you do stink.
Yeah.
Oh my. That's 409. And they didn't say that it was loose or anything. You don't smell it?
No, now I do.
I was gonna say, oh, I smell it good. Oh, nasty, girl. And have we been doing anything with that, clipping it, cleaning
She
it?
just
She
got back.
She just got
yeah.
back yesterday, that's right, okay. What date, what was the date that she got seen on?
February.
210.
Oh, 2 days ago. Well, girl, you just got sedated 2 days ago. Should we do it again and see if, I mean, they didn't make it sound like it was going to be a hard extraction or an easy extraction. They didn't really say too much about it. Didn't look like.
No.
But maybe what we could do, because I don't have spreaders. I don't know how easy this tooth is to look at. We could just do antibiotics and try to get this thing to start clearing up. But of course, it's not going to go away entirely without getting that darn tooth out of there.
Right.
And they haven't sent you the x-rays yet.
No.
Maybe we do an antibiotic and pain medication plan until we get a chance to look at the x-rays and decide how bad of an extraction this is going to be. And maybe whoever's going to do it, we can talk to Stillwater and say, hey, like, what was the situation? Was that tooth going to be a
Sure.
2-hour extraction, or what are we looking at?
Sure.
'Cause I don't know if I want to get into 2 hours on today.
Yeah,
Right,
no,
right.
we got other
Today.
things to do.
I already have other things defrosting in the room, so, and this plugged up, the switch is like frozen.
jeez.
I can't even turn it on.
Oh,
so
no.
Everything's froze up bad.
Well, I think we're-
You guys have Uniprem? Could you do it twice a day?
We can.
Let's do twice a day. I mean, she's only gonna be like a scoop and a half anyway. And, Banamine for the next few days as well.
So
And
do
if
the
she-
scoop a half twice a day.
1.5 twice a day. Yep. And then I would say too that if she lets you, but I doubt she will, flush it with iodine try.
Try and get it cleaned up a little.
Yeah, that one, if it's gone all the way, that's crazy that it went all the way from the root. I mean, think of all the rotten teeth we see, and then hers went like that and went clear through.
Yeah.
It also makes you a little nervous opening up, without seeing the x-rays, opening up a mouth if the mandible's going to be really bad shape and crack.
Oh,
So,
yeah. All right, we'll do that.
Let's
And
do
then I
that.
think
let's give her a week and see how she...
I think we're done up here, and now we'll head down to
Okay, no
quarantine.
more evals down here or anything? Okay.
So first one we're gonna start with is Yoshi, Yoshi.
Okay.
He's supposed to be a Belgian quarter horse cross,
Okay.
roughly 3 years old, they said. Only thing obviously noticeable with him is pretty decent sway
I
back.
was going to say, is he the swayback one from
Yeah.
Facebook?
We're thinking genetics at that age, you'd hope.
It sucks. Or like something, it'd be interesting to x-ray him. It's like, do you have some weird vertebrae, like malformation or
Yeah.
something like that? Which if Val was around, maybe she could get a good feel of it. But
Right. Come on, Yosh. You'll fit. Good kid.
you are a young boy. Oh, it's slippery. You got ice balls in your feet. There, he's okay. 14.
Yep. He's Belgian quarter cross is what they said.
I just hate this time of year when they're rocking around on those balls of their feet, you know.
Yeah.
Sucks. Hi, sir. I know, you have a goofy back. What's going on inside there? Is it sore? Not really. Yeah, it'd be really interesting to see if you could get an x-ray of that. I don't see any manberries,
Good.
but he doesn't really look steady. Hey.
No, he doesn't act it either.
Easy.
Careful,
Easy. Yoshi. Do we have a lot of like Mario Brothers names, or what's the deal?
Yeah, we did the Mario Brothers theme. But we didn't get a Mario.
You did not?
Nope, we got a Luigi.
How do you not get a Mario after
I
that?
don't
That's kind
know.
of a fun horse name. Oh, uh-oh.
There was one of them out there that was coughing and snotty, so.
He's 103.4.
Oh boy.
I didn't think his lungs sounded bad or anything. Are you sweet?
What are you doing?
Everything sounds okay. Did they shave you because you were getting lymph node issues or something? Hi.
He shaved up behind his ears too.
Oh, maybe he did just have a... You live in the cocklebur? They don't seem tender. Maybe a little... His lymph nodes feel a little firm, but... He's got... With that high temperature, I mean, you're going to want to keep these guys... He does a little snotty nose. So... I don't feel like just kind of a firm lymph node, but not really that swollen. Hopefully it's just straight up like a strep zo versus strep equi. I think the last time we cultured these guys, that's what they were getting, was just the horsey shipping fever. Yep, you're getting a snotty nose. You get to have some antibiotics then, sir.
Just look at your teethies.
Oh, you
You
are.
are.
Oh, that's ugly though. What'd you do?
Oh yeah.
Did you bang that? Is that, I hope that's just a... What do I have to...
You're just a
Is that
young
your-
buck.
But it's coming in kind of goofy. Okay, well, we're going to watch that because I don't want him to now end up with messed up teeth because he whacked one when it was, young.
Sure.
These all look like baby teeth to me, though.
I think 3 is a good assumption.
Maybe 2.5, Yeah, 'cause to me, that... It seems like that should be an adult tooth coming in that just hasn't come down, so that would put him, 2.5, 3. But it's kind of a little bit crooked, so we're going to see how things grow on him.
Okay.
Well, if it's anything like your back, it'll be crooked. All right, well, upper respiratory on him. You're going to do some Uniprim because of the snotty nose, the fever, and we're going to be checking your Rheosis temps. Your hand warmers aren't actually that warm.
Do you need another?
No, I'm okay. I'll make it.
So next horse coming in is Dixie.
Oh, you guys are right on it. All right.
Yeah.
I was going to warm up my gloves. They were crispy.
How old is she supposed to be, Brooke? 13. Oh, yeah. We traced her brand.
Oh, cool. Is she a standy or?
Yep.
Okay. Oh, it's on the other side. 13 stand.
$9.50.
Okay.
And we did take some x-rays of her fetlocks in the front.
So that's her issue so far that you
Pretty,
Hi, sweetie.
pretty bulgy down
Oh,
there.
yes, you are. Hi. You're really cute. Oh. We gotta know where you're at, because if your buddy out there is that got a fever, I don't know where you're at. Has she been lame, or you just kind of took the x-rays because she looked funky? Okay.
Yeah.
97.6. Can you say ah a little bit? Even though you're not rinsed out, the front few teeth look pretty good. Nothing really exciting up there. All right, hey, can I see your feet? Oh yeah, ooh, they are really puffy. It's not just bone. Well, there's some bone here, enlargement, but that's like actual joint effusion.
Yeah, the x-ray was pretty rough.
Okay. Ooh, it goes right up the tendon sheath, up the deep. Oh, is that the deep? Huh. All right. Can you lift it? Oh, the knee popped there too. That was gross. I don't know if you heard that.
I did.
Oh, this has got like no flexion at all. A little bit down here. It's kind of funny. You can see a little bit of how it flexes down in the pastern, but this joint does not move. She's kind of clicking in there too. Okay. Okay, so that's her front right. It doesn't look that bad radiographically to start. We definitely have some arthritis there. A little icky right here. All right, I just double click. It's over here. Okay.
Yep, you just click on whichever one you want. I just did some DPs.
And this is her good leg.
Yep, next one's rough.
Oh, God.
Lots of junk in there.
That's disgusting. And there's active, so it's active too, because you can feel the effusion in the joint capsule. I'm surprised she's not more lame. That looks terrible. Is that something you guys would be willing to send up to? Oof. Wow. That's probably this is more like, it's like ring bone in a pastern, but it's in her fetlock, which is not something I usually see.
Yeah.
And it's in both sides. And I wonder if she had an accident or something. For a second, I thought it looked like there was a little fracture here.
Sure.
But I'm wondering if that's just that maybe that her splint bone is kind of turned, because you see how in this view it sort of sticks out.
Yeah.
And so, but then
Oh, so it's like, I see
yeah,
what you're
it
saying.
might be kind of turned. You could, I mean, you could try another oblique angle to try to get a better look at this, because for a second it almost looks like it's a fracture line, but the
Okay.
cortex of the bone out here looks okay. I'm thinking it's more likely a splint and then just a whole lot of other problems. But this is almost, looks like a cyst here. It's kind of light, and then you have this extra bone, so it's like a combination of new bone and eating away bone. And that would be something. Yeah, she's, really bad. I don't know if that would be something for an orthopedic guy to decide if they could do much. It's darn infused at this point, it doesn't move, but there is joint effusion, so if we can at least make it a little bit of a happier joint, she can just do her thing without it moving too much. I would consult an orthopedic person on that, because that's a pretty advanced situation there. I wonder if, I don't know if I'd do an OSFOS or anything like that yet on her until you figure out if that's something that they want to possibly fix surgically.
She's only 13. So
Right, exactly.
Right, she's young.
And she didn't seem that painful on it. I mean, so the way she's moving, maybe they can just kind of hurry up the fusion, or they just tell you, no, we're not going to hurry up the fusion. We're just going to monitor it. But it just seems like some of these pieces, like they could do something with that. That's ugly. And since it's both sides, I thought maybe, I'm like, well, did something happen to this joint? But it's both sides, so
Yeah, I thought maybe she had a crash or something.
yeah, that's what I was wondering. Well, because at first, too, when you look at this one, I thought it almost looked like there could have been a fractured piece right here. But I'm not so, like, I mean, that's definitely off the edge, but I'm thinking more this whole triangle piece.
You said take some obliques to try and see
you
that.
could, you could definitely kind of do it a little bit more of an angle, but then I wonder if it's more the way her splint bone hangs out, and we just maybe caught that splint bone just perfectly like this instead of turned.
Sure.
And so it could be that's why it looks like that, because her splint bone does sort of stick out right there. But there's definitely a lot of little pieces that are loose, and that's the question. Could they do something surgically to make this a little bit more quiet and comfortable joint? Might be worth a shot. She's younger, and she's...
Careful with them ice balls.
960.
This is Luigi, Luigi.
Okay.
Said adult on the Coggins, so we 12.
Adult.
Yeah. 12
So he's
plus.
a standy too.
Yep, standy. He wanted us to take some x-rays, so we did that. If you want to take a look at those also.
Okay.
Brand hair, we flip it down, it's a bunch of white hairs.
Oh, brand.
Do you just always stand weird and make your feet flare funky, or what? Oh, I see.
Oh.
He's got those oral plaques in his ears,
Oh.
which they suck because then you have to put ointment on them and then they really hate you.
Oh boy.
What you do? Oh, busted a tooth out of the bottom there. That one.
Yeah.
And that root is still there. So maybe he could have a dental with an x-ray and see if there's anything we can do about that. But yeah, he's got to be 20 at least. All right.
Okay,
the
so
warm
yeah,
room.
Polly wanted pictures of his feet. We took some.
Okay, they're long, that is for sure. A little bit of ring bone starting, maybe. They're not rotated. He just seems a little bit rough, like there's some ring bone, like you can kind of see.
Yeah.
Like there's a little bit of arthritis. This is kind of rough here. You can see that it's just changing the surface of the bone. But just from, without like sitting and measuring, this looks fairly parallel. And I feel like he can do a lot, and there's some sole there for him to work on. Same on this side. He's got his nice spur back here. Some ring bone and arthritis. He might be a tiny bit rotated on this side. Seems a little wider here.
Sure.
But this horse can get a lot of footwork done, and we probably have a chance of fixing that up a bit. This one looks a little bit different. I don't know, maybe he wasn't putting as much weight on it either, because he just looks different in that one. And we're a little bit off the side.
Okay.
Same, it's the same spot in all of his feet here. He's just gets
He's got some stuff
some
going
ring
on.
bone. A little bit more on
Yeah.
that joint. Yeah. DPs are nice because you can really see like that coffin bone. You can see the wings. Like, does
Okay.
that wing go up really high? So I would, in general, 2 views of every joint. But if Polly just wants to kind of see rotation and how much sole in a lateral, and if that's all he needs for that, that's
Yeah, he didn't really specify, so we just kind of
if
took the
if
basics.
that's all he's thinking. But I mean, in general, try to get 2 views of a joint.
Okay.
But yeah,
So just show him to Polly
So-
and go from there.
some arthritis and a lot of foot to cut off.
Okay.
Name again? I'm sorry.
Princess Peach
Oh my God.
is coming in next. She's adult again, so not sure on age.
Another standee.
Yep, another standee. Oh yes, we did trace her brand. She, I believe, was 14.
14 years?
Yeah.
It's fun when you can actually
believe.
figure that out more exactly.
Did we notice anything with her specifically?
Polly noticed when he was trimming her feet that she has really bad thrush in the hind and it's
Oh,
eaten
yes.
away quite a bit of her foot.
Okay.
She does walk not correctly. I'm not sure if that's fully due to the thrush. Seems like something more might be going on there.
Sure.
Otherwise, poor body condition as well.
It's just kind of hard to treat something like that until you
Right.
guys get her up in the barn and can keep her feet clean.
Yeah.
Did he just clean it out and put some copper tox, or?
Yeah, he cleaned it out, trimmed away the dead stuff, and then we've done 2 thrush treatments since then.
Okay.
Good girl.
Easy, easy, easy. You're a different colored girl. She walks kind of funky too, but she's also thin, and her fetlocks look a little puffy to me, even on the backs there, that white
Oh
one.
yeah.
It's funny how the front of her feet, it's like, is she striking it or something? You see how it's all like worn on
yeah.
the front and kind of like she's been banging it?
Think she's dragging it or something, maybe?
Dragging it or banging it, but you'd think if she was hitting it here that you'd see some. She didn't have shoes on or anything, did she?
No, no shoes.
You just seem kind of thick all over. This pastern is definitely thicker than this one.
You can take
good
some
girl.
x-rays all around.
Yeah, it wouldn't be a bad idea. This one feels thick. Maybe today's ring bone day, and yeah, that fetlock is definitely big.
Yeah.
Not just that it's white, girl. Sometimes the white ones stand out. 97.5. Well, at least nobody else has had a fever yet.
75?
97.
Oh. I was like, wait.
No. That would be approaching room temperature. You'd be dead.
Yeah.
Right. You said 14 you had?
I believe so.
Okay. And that one was one you had actually traced.
We have our brand. Maybe it's 12. I would assume you copied what was in Shelter Love. Oh, then yeah, it would be 12 because I updated their birthdays, so.
Oh,
Okay. A 12 and a 13-year-old, not a 13 and 14-year-old.
keep sticking your tongue out at me, you goofball.
You know, right?
Well, I feel like the fact that she's not been able to gain weight is like we should, at that age, we should be doing a dental, even though I don't see anything right in the fronts. I mean, she's a little crooked on her front teeth. You see that, how it swipes up, and this one's a little long.
Mm-hmm.
I would have thought she was a little older than 12, but if we traced it. Okay, let's feel those back legs, honey. Yeah, look at that bad boy. She likes to rest this leg more than the other one, too. Oh yeah, that's a thick fetlock. Yep. Wonder if we'll see anything in your... No, just... Oh wow, yeah, it ate in there a little bit, didn't it?
Yeah.
Yeah. Good girl. Well, she's got some flexion in it yet. Why don't you x-ray those?
Okay.
Wouldn't hurt to go around, because I felt like this one feels a little thick to me, too.
It looks it too.
So,
Okay.
We don't have to spot in your eye as well.
yeah, look at that. Let me get my light. You just, everything on your left side is just beat to heck, isn't it? Well, you still got dazzle. And vision. I'm guessing that's just scarring then, because it doesn't really look active to me.
Okay.
It's actually got a lot of pigment change to the outside, so see that dark along the edge instead of like white?
No.
Yeah, she'll let us. I got a little bit of a look of it, and so I think it doesn't look, at this point it looks like scar tissue.
Okay.
Okay. Left. And what else? Yep, she was 12. You know, her teeth look older, but all right. And she's skinny.
Yes. She's good. So the next one coming in is Peach. Just Peach.
You ended up with a peach and a princess peach?
Yeah.
I suppose there's not enough like Marios that are girls.
It was a tie too, so it works.
We
It's
could have done
different.
one princess and one peach.
That's true. She's Belgian Halflinger, supposed to be 5 years old.
Okay.
And her left hind fetlock is all swollen up, pussing, stuff like that.
Pussy?
Pussy. Or oozing out stuff, I should say. She's timid, and when we did try and touch that leg, she said no bueno. So we weren't able to get x-rays yet.
It's like crooked looking and everything.
Yeah.
I'm just gonna keep this shut because I feel like we might have to.
Okay.
I don't like the look of that.
She's a nervous kid.
What were they doing to you? God, she's even like, her toe
Just trying
doesn't
to
point
take
the right
x-rays.
way. Yeah, that might have to be a sedated situation, huh?
Yeah. That's what we're thinking.
I tried touching just her front seat yesterday, granted she was kind of stuff, and she wasn't stopping.
Well, she doesn't look like she slows down, does she?
She's supposed to be pretty young too.
Yeah, a little flighty yet. Yeah, I'd really like to. You said there's discharge, or do you? I mean, that thing is the angular.
If you come more on this back side, if she'll let.
Oh, I wonder if
Something
she's
right
rubbing
there.
it.
Yeah, I don't know.
Hopefully, she's just rubbing it, but it looks like it's a bad angular limb deformity at the fetlock. Because you just look at her hock like this, and then her toe goes like that, and then it rotates a little. So, unfortunately, if it's an angular thing, there's her age, we're not going to be able to do much, but... Hi, honey.
You're okay,
So
girl.
nervous. You want to go in that warm room? Me too. Ooh, let me listen. Grumpy Growler. I don't think we'll be getting her temperature today.
I don't think so.
Hey.
Hey.
Cool it, little peach. You're not a peach. You look like you're gonna bite me too. Hey. Hey, hey, hey. Hey, 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 hey. Oh, watch out. Well. Oh, really? Oh, you. Well.
Watch your arm.
I'm kind of thinking that we just got to get her sedated so we can x-ray that thing and decide how far we can go with her.
Okay.
Because that might not be a good one to deal with, especially if she's getting to the point where it's breaking open to the outside. I'm hoping she's just rubbing it because it's such a bulbous joint that she just happens to get a rub there. But if we got something worse going on, then we might not be able to do much with it. She's a big girl.
Okay.
Just look at her go.
So next coming in is Birdo.
B-I-R-D-O?
Yep. Adult. So not sure on age.
Is he supposed to be another standy?
Standardbred, yep.
And he does have a brand as well.
Oh, does have a brand, so we can check his brand also.
Was there anything in particular that you...
Nothing overly noticeable on him.
Okay. Just some toes
Yeah.
worked on.
10:45.
I thought your eye was sunken. I always got an old, like, the edge of his eyelid sort of scalloped. John, when you said?
29, yeah.
On
That-
On Luigi.
The one that looked older than...
yeah, the teeth were hurting
Yeah,
there.
yeah, okay. Makes sense.
Arthritis in all four. Not on this guy.
Okay,
Girl
I
or
was gonna
guy. I
say.
don't know who. Girl.
I don't know if we... Hi, bud. I'm gonna take your temperature. Maybe you'll let me. 98.6.
98.6.
Okay. So you said you hadn't noticed anything else exciting with this
Not
fella.
really.
Took my light out of my pocket. I want to look at that eyeball. I'm just going to shine in your eye a little. So he looks like he's got that little L-shaped.
Yep, I see it.
But it's like, is that just a goober? Because it's moving now. He's just got
Yeah, I think
goobers.
it's just-
Good. I thought he had a scar like that one, so.
Just a boogie.
Yeah, some eye boogers. That's good. All right. So we're going to figure out his age from his
Yeah, we'll do our
Mark
best.
II. Hey. Oh boy. Long in the tooth, he says. Hey. Oh, you banged your little lip. He's got an owie right there. Try not to squeeze it. I mean, I had to put him 18 to 20. But maybe he is younger than that. Maybe he's actually only middle-aged, like you were saying, like that 15.
All right, next one coming in is Rosalina.
You're gonna spell that.
Rosalina.
Okay.
She's supposed to be about 10 years old.
Another standy.
Yeah. Something.
Nancy, we can't have a light alive.
Come on, girl. You're all right.
Don't
I see Arab too. I don't want to just.
Yeah.
790.
She just had a scar on her back leg that we noticed, and
Yep,
at the
I see
auction
that.
they mentioned.
Both sides.
Otherwise,
Must have got wrapped in something.
yeah, she was the one with the snotty nose.
She's got a really deformed front right foot. See that clubby, weird-looking thing?
Oh yeah.
See the shape of that?
Yep.
Paulie would probably tell you to x-ray that before he'd be comfortable trimming on it, I would imagine, too.
Okay.
Because it's like, it sort of bulges out above that cut, so I
Right.
hope there's nothing brewing under there. Hi, you're so very excited. Can you calm down, please?
No.
You look like you're about ready to go up through the ceiling. Yeah,
She
see?
might.
Hey, hi, Mare. Hi. What do you want? You didn't want to be tied. You don't want to be in here. What? How you doing? How you doing? Take it easy. That was a good one, huh? Guess we're not taking your temperature
On
either.
my life flash.
She reminds me of Bella.
At least she kicked backwards, not forwards.
There was a gust of wind from that one.
Okay, sweetheart. Oh my gosh, really? It's just that's a gulp. Hi. You need to calm down. You got big old wide eyes on you. Easy, baby. Easy, baby. Oh, what do you think? Do you say ah? You're not too very old. Like 15, you guys said? 10, 15?
10 is what we have, yeah.
You're just fine.
Hold on, let me count those front teeth real quick. That one looks goofy to me. Hey, hey, hey.
Spicy kid.
She is a spicy kid. Her corner incisors are a little long on that side.
Okay.
But yeah, I could buy 10,
Okay.
10, 12. And
Sounds good.
that goofy foot. And
Sounds
I'm not
good.
going near the back of her.
She looked back like, are you sure? You can
Well,
go
did you
back
see
there
that?
and check.
That fired off was really a quick little one that without any kind of warning. But I mean, yeah, I see that the front of both of her canine bones look like they got kind of skinned up a little
Yeah.
bit, but they don't look that bad to me, and
All right.
not worth grabbing.
So Brooks got Rocky down here today. As you all have seen, he's been doing pretty good lately. But today we are going to try Al the alien in the saddle and see how he handles it.
Okay. Let's get the spunkiness out.
He says,
He's
"What is that?"
eyeballing him. Oh, come on.
He's like, "What are you doing?"
Try not to get caught on the saddle either.
Yeah, that would suck.
That'd not be fun.
A little introduction.
Want to say hi?
That's Al.
Ooh, Al is dusty.
Rocky, Al, Rocky.
Al came out of retirement.
He did. On a cold day, too. Sorry, Al.
I don't think he minds. Don't bite. Ooh, you're dusty. He's like, can I bite him?
Can I eat him?
Okay. You don't even mind that?
So come on, Al, work with us.
Yeah.
I know you're tired.
I think it's the best we're gonna get.
Alright.
He really did not care.
No, he did not care about that at all.
You little trot.
It's so funny looking.
It's like, why am I lunging again?
He's so over this. So you guys just brought me out here to play with me, huh? Make me look goofy. Heck yeah.
What you think?
I say we call that good, and next time it might be you.
I'll be Al.
I'll be Al.
Afterwards, probably.
I have faith. Love your nose, Rock. 1, 2, 3.
We set up horses to the horses.
Perfect. You're okay, Lex. Very good. Go slow. Very good, Lex. Alright, Flynn, go ahead, bud. Good job, buddy.